Hi, I'm Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how physical therapy can improve sports performance. So, athletes can be of all ages, and we don't discriminate here. It could be anyone from the weekend warrior to a professional athlete to even your 7-year-old who needs to make his little baseball team. And we want to make sure that everybody can do what makes them happy, safely and efficiently and effectively, and to prevent injuries. That being said, athletes of all ages can experience sprains, strains, and injuries while playing their sports. We want to make sure that we get to the root cause of how and why they got injured. Now, the obvious injuries in sports can be impact-based. So you have a football player or a soccer player for that matter, who is slide tackled, right? Another body coming at them really fast can result in broken bones, torn ACLs, things like that. But sometimes what we're seeing is more overuse injuries, or the complete opposite, that weekend warrior who has not done any strengthening or conditioning, and all of a sudden they're back out there and their body isn't prepared for the demand that's being put on it. So some of these injuries can be caused by things like poor movement strategies, or poor posture while they're doing their sport. Poor training or coaching. You know, the coaching rules for kids are changing all the time now on what's actually allowed to be taught to children and how they're modifying, for example, how children are tackling in football, as an example. And generally overwork. One of the things that we have as a very hot topic in physical therapy and athletic training nowadays is youth specialization. You know, a lot of parents are putting extra pressure on their kids and kids themselves, right? They all want to be the next top professional athlete, the next Steph Curry, for example. And although we want them to strive and work hard and be very fit and maintain that active lifestyle, we also don't want to recommend youth specialization. And what that means is if you have a child who only wants to play basketball, he wants to be that next Steph Curry, for example, we want to make sure that if they're doing a sport that is very eye-hand dominant, for example, that they are also doing a sport that includes the lower body. We want to make sure that kids are not doing the same repetitive activity over and over again. That can cause injury to their tissues. So again, another example, Little League, right? Baseball players, pitchers, getting early torn ligaments in their elbows, needing Tommy John surgeries at 10, 12 years old. This isn't normal, and this isn't something that was happening in the past, but as we're pushing our youth harder and harder, we want to make sure we're protecting them as well. So the general guideline that's out there right now, and again, there's many schools of thought on this, but what I've told a lot of my parents with regards to children is based on age. So for example, if you have a 5-year-old, they should not be spending more than 5 hours practicing their sports, and it should be in a diverse variety of sports. If they're 10 years old, they wouldn't be spending more than 10 hours a week. We're just trying to protect their growing bones and tissues to make sure that we prevent injuries in the future. You might not realize that if you're pushing your children at a young age, that their tissues could be weakened and it could lead to future problems when they are an adult. How physical therapy can help athletes, again, children or into adulthood, is to, of course, rehab specific injuries. Again, we do handle traumatic and overuse injuries all the time, and that can be even within the same sport. My background's in athletic training, and I worked with the baseball team and football teams at a college years ago. And again, in football, I was seeing many more of the traumatic injuries, and in baseball, I was seeing a lot more of the chronic overuse injuries. Once we kind of know the sports that a person is interested in, we can develop strengthening programs to ensure that they're strong in the right places and based on the sport's demand, whether it has to be more endurance-based or power, quick burst kind of based activities. For example, the sprinter versus the marathon runner, they're both runners, but they have to be trained very differently and they use different muscles in different ways. We also want to address the underlying movement strategies that they need for whatever sport. That includes their posture, their balance, and muscle imbalance issues of are they weak in some places and strong in others, or tight in some places. All of that needs to be addressed based on the movement patterns that they do. We take into consideration things like, are they jumping sports, right? So how are they landing when they jump, for example? Or again, in the example of those baseball players, sometimes even though they need to work on their batting, sometimes their coaches are going to have them sit there and swing forever and ever, and they are going to overuse their upper extremities, and we will help teach them things like how to use their lower extremities to drive power from their hips and their legs. Some of my other adults, same thing in golf. We'll see overuse back injuries in my golfers, and really what I find most of the time is they're not using their hips and their legs to help as much. They're just whipping around that ball and kind of overusing their back. So we do want to break down the sport specific. I want to make sure that I state, though, we are not specific coaches in any of these sports, so we don't want to step on anybody's toes. We are looking at the biomechanics and the anatomy to make our decisions, and we are happy to work well in conjunction with the coaches, and whether that's getting on the phone or doing video assessments and meeting with them, we want to make sure that no matter what, we're all working towards the common goal. Other things we do in PT, like I mentioned, would be improving flexibility, generalized strengthening, and sport-specific re-education for the movements necessary for their activities. If you have any other questions or would like to set up an evaluation, please call our front desk and we will get that set up as soon as possible. Thanks so much.